Hi, and welcome to ChurchTherapy.com's Pastor Training Videos. I'm Kristen Kinsevich, licensed mental health counselor on staff at East Coast International Church in Lynn, Massachusetts. Today we're going to be talking about some of the common mental health disorders, just to give you an overview of the kinds of things you might hear some of your parishioners talking about that they're receiving treatment for, or maybe you're experiencing symptoms of. So the information that I'm going to be using today directly comes from the DSM-5, which is the Diagnostic and Statistical Manual that therapists and doctors use to diagnose common mental health disorders. Its predecessors were obviously the DSM-4, 3, 2, and 1, and really since the 50s, these have been in development to try to research and understand mental health disorders. And so the book basically gives categories of symptoms and highlights what specific symptoms fall into different categories. So I'll walk you through the categories in a little bit. I do want to just mention that I have written this book called On Edge, Mental Illness in the Christian Context, and in that book, which is available on Amazon, I go through a variety of the common disorders from a Christian perspective, talking about how we can understand these things and help pastors and Christians, how we can help others who are struggling with mental health issues. Also, in my other book, Emotional Traps, again, also available on Amazon, or if you are on my blog, you can see a link to that. Emotional Traps, Finding Freedom in Everyday Life. I do go through in the chapter on thinking some of the specific disorders that are found in the DSM-5. So let's go ahead and go through these now. I'm just going to go through and talk through these different categories. So the first category that the DSM-5 lists is neurodevelopmental. And so those are the kinds of disorders that you're going to see with things like autism and the autism spectrum, which is a range of symptoms going from kind of milder symptoms to more severe, completely nonverbal autism. And then you have attention deficit disorder that falls into this category as well. That is seen in childhood. If you have someone come and talk to you and they say, oh yeah, I think I'm getting ADHD or ADD in my old age, I'm forgetting everything. That's not truly ADD. It has to be diagnosed prior to age 12, or the symptoms have to be present, whether or not it's actually diagnosed by a professional. The symptoms are usually present in a variety of situations, school, home, church, maybe, those kinds of things that across the board people are seeing those symptoms prior to age 12. So just so you understand, that's part of the diagnostic criteria for ADHD. And then there's learning and communication disorders that also fall into the neurodevelopmental category. Then we move into psychotic disorders. Now obviously right there in the name you know that psychosis is going to be part of this disorder in this category. So you're going to have either sometimes a brief psychotic break where someone temporarily for a shorter period of time experiences delusions or hallucinations, basically seeing or hearing things that aren't really there, maybe some paranoia, thinking everyone's out to get them, kind of disorganized or detached thinking that just doesn't quite line up with reality. Or it can be chronic, so these things can happen and stretch on and continue. Things like delusional disorder, certainly schizophrenia, fall into this category. And as well as, you might not have heard of schizoaffective disorder. That's a combination of schizophrenia and mood disorder symptoms like depression. And delusional disorders or psychotic disorders can be due to some other medical condition or substance induced. So if you had, a person show up, especially maybe if you're in an inner city area and they seemed, like they were really detached from reality or not together, and they were on a substance, then it would be potentially a substance-induced psychosis rather than, okay, they have schizophrenia. So you would want to rule that out, or a doctor or therapist would rule that out. Next category you have is bipolar disorders. And there's a few categories here. So bipolar 1 disorder is an alternating manic episode and depressive episodes. And so these can be, again, this can happen for a shorter time or be more chronic. And the depressive episodes or the manic episodes may last for longer periods of time, like several months at a time. Some people experience rapid cycling where the ups and downs are a much faster switch. But you going from manic symptoms of, risk-taking behavior, maybe overspending, promiscuity, those kinds of things, and down into depressive symptoms where for a period of at least 2 weeks they're experiencing some kind of depressed mood, sadness, hopelessness, worthlessness, difficulty sleeping, or changes in eating and weight, those kinds of things. Then bipolar II disorder is actually where a person experiences a depressive episode, but then instead of getting all the way up to a manic episode, they only reach a hypomanic state, which is a little milder, and so it's distinguished that way. And then you have cyclothymic disorder, and that is where the depression is mild and the manic symptoms are mild, but there is this cycling back and forth, and that tends to be chronic. Next category we have is depressive disorders. So obviously you're going to have major depressive disorder in this category. Again, this is having depressive episodes over a period of time. So you're not necessarily depressed all the time, but a depressive episode, again, is at least 2 weeks of experiencing these categories of symptoms. Suicidal thinking may or may not be a part of that, depends on the severity. And then people can come out of that and be okay for a little while and then slip back into a depressive episode. And so that's what you would see with major depression, but you don't see the manic symptoms in someone who just strictly has a depressive disorder. Then you have dysthymia, which is, again, a little bit more of a milder kind of over maybe a 1 or 2 year period, a continuous sense of just being down, low mood kind of all the time. Sometimes I think of like Eeyore kind of person, they might be experiencing that dysthymia. And then for women, premenstrual dysmorphic disorder is one in which there's a severe depression right before the menstrual cycle begins again, and so that would be something that is certainly researched, and there's more research being done about that. But for many women, this is not just your typical kind of hormonal disruption, but it's a really severe depression that happens, and so that can be really crippling for people who are struggling with that. Next, we have anxiety disorders, and that would fall into categories such as phobias. So there might be a specific phobia, like a fear of snakes or fear of airplanes or that kind of thing. Or you can have panic disorders that are falling into the anxiety category. Could be a panic attack, or just kind of other categorization of panic symptoms where it's not necessarily a full-on panic attack, but there's some sense of sudden fear. You can also have agoraphobia, so that would be people who aren't able to leave their home. And so again, if you maybe have gotten to know someone through an outreach or home visitation, and they just can't get to church because they can't leave their home, that would be an extreme type of disorder, but that could be possible that you could encounter that. And then you have generalized anxiety disorder. This is a really tough one because this is really seen in worry. And so, the Bible talks about don't worry or be anxious about anything. And this is something that is really beyond the control of the person who's experiencing it. So they would love to stop worrying, but it's really a pervasive and very severe kind of worry. It's not kind of your everyday stress, but this is something where across the board you're really feeling sure that something bad is going to happen across many areas. So maybe you're worried about your extended family and your immediate family and work and all these things, and you're kind of just waiting for something bad to happen. And it's more than even just waiting, but it's a kind of sureness that something is going to happen, and that it's this constant kind of fear that you're living with. And then there's social anxiety, and this is going to be such a tough one in a church context. That moment every week where you say, okay, we're going to take some time to go ahead and shake each other's hands right now. You're freaking out all the people who might struggle with some social anxiety. And so, again, this is different from just introversion or, maybe a lack of social skills, but this is really a genuine kind of physical anxiety feeling when you're in a certain social situation. So Those are the anxiety disorders. Then there are obsessive disorders, and so these are things like obsessive compulsive disorder, also body dysmorphia, so body dysmorphic disorder, excuse me. So for people who have anorexia, this can be a struggle where they see their body appearing differently than how it is in reality. So they may look in the mirror and actually see themselves fatter than they are, and so there's kind of a disruption in perception of reality there. Also things like hoarding or trichotillomania, which is a hair pulling disorder. So those are the obsessive disorders. And lastly, what we're going to talk about is trauma disorders. And again, there are some other categories that are less common, but I'm going to end with the trauma category. Obviously, things like PTSD are fairly well known. You think of war veterans and things like that. Certainly anyone who's experienced abuse or any kind of trauma could be susceptible to PTSD. And then you have acute stress disorder, which is really occurring right after the event. So PTSD is generally 6 months after the event has occurred, but acute stress is that immediate reaction, maybe after something like September 11th, for example. People who maybe were experiencing a lot of anxiety or panic immediately after that incident, that would be acute stress. Then you have reactive attachment disorder, which can be common in adoption situations or children who have been traumatized, where the attachment normal bonding process that's supposed to happen in the first year, but even up to 5 years, was disrupted. Maybe the primary caregiver wasn't available, or certainly in like an orphanage kind of situation, maybe overseas, they've seen that where children's needs weren't met early on. And so whatever situation can disrupt that, those then persist and they have trouble forming attachments later on. And so then you see that reactive attachment disorder where they really resist getting close. They kind of want people close and then push them away, and want them close and push them away. And so if you have adoptive families in your church, some of them may be experiencing a child with reactive attachment disorder. And finally, there's adjustment disorders, and these are things where, your common everyday life things happen, maybe a job change or a sudden loss, and a person begins to experience depression or anxiety around those things, and really it's situational, but the response is a little bit more than the person can kind of handle in a given moment. They're not necessarily have a history of mental health issues, but for that brief period of time in the transition and adjustment period, they may be experiencing more severe symptoms. I hope that helps give you a broad overview of some of the kinds of symptoms and disorders that you may hear about, and I hope that just talking about mental health and mental illnesses can increase your ability to talk about them with your congregation. The more that we talk about these things, the more we just accept the fact that there are physical realities that people are experiencing that are coming out and manifesting in our emotional lives and in the way that our brain is functioning. And unfortunately, there's just been a huge stigma around these disorders for a long time, as people don't understand them or feel like maybe they're not real. But we really need to do our job as Christians to speak about these things, to bring awareness to this issue, so that people don't, hurting people aren't taking it upon themselves and blaming themselves, even turning it into a spiritual issue rather than getting the help that they need. So I hope that helps. I'll see you next time.